Welcome back to the Abnormal Psyche, where we delve into the complexities of the human mind. Today, we'll be discussing the fascinating world of schizophrenia.
Here with us today, we have five mental health professionals, including clinical psychologist London Goodwin, neuroscientist Tatiyona Bridgewater, psychiatric nurse practitioner Jaden Moody, forensic psychologist Sky Thunder, and child psychiatrist Kiera Page.
Now, schizophrenia is portrayed in many different ways in the media. Let's hear a professional opinion on what schizophrenia is.
So, according to the National Institute of Mental Illness, schizophrenia is a mental illness that affects how a person thinks, feels, and behaves.
Can you tell us a little bit more on how a schizophrenic person may present?
Symptoms of schizophrenia vary per person, but usually fall within one of the three categories: psychotic, negative, or cognitive. Common psychotic symptoms include hallucinations, delusions, and thought disorder. Negative symptoms include loss of motivation, withdrawal from social life, and difficulty showing emotion. Lastly, cognitive symptoms include having trouble focusing, paying attention, and having trouble processing information.
Yeah, I think I'm a little delusional by my man.
Same, my man.
Can't relate.
At all.
Actually, delusions are false beliefs that are not based on reality and are often associated with mental health conditions such as schizophrenia, bipolar disorder, and delusional disorder. So, unless you have one of them, you are not delusional about that man.
Probably obsessed since I'm not delusional.
Well, now that we know the signs of schizophrenia, what causes should we look out for?
Unfortunately, there is no specific cause of schizophrenia, but it is believed that genetics, environment, and brain chemistry play a role. It is also estimated that the prevalence of schizophrenia in U.S. adults ranges from 0.25 to 0.64%, and internationally, the prevalence of schizophrenia among non-institutionalized people ranges from 0.33 to 0.75%.
All right, we've laid the groundwork. Next, let's discuss how professionals diagnose and treat schizophrenia.
Schizophrenia is a chronic condition with no definitive cure. However, symptoms can be effectively managed through a combination of antipsychotic medications and cognitive behavioral therapy.
How would a doctor diagnose this disorder?
Well, schizophrenia often presents gradually, starting with the stage called the prodromal stage, during which a decline in normal functioning and mild forms of psychosis may be displayed. These symptoms start as suspicious but become clear indicators of schizophrenia when distinct symptoms of psychosis are observed. The process of diagnosis includes a physical exam and a review of medical history, including psychiatric history and family history. This history is observed because diagnosis is largely based on the period during which symptoms have been observed. If these symptoms, including delusions, hallucinations, disorganized speech, reduced ability to function, and catatonic behavior, characterized by a lack of movement, activity, or expression, coma-like to say the least, are observed for over 1 month and cause a disturbance for over 6 months, according to the DSM-5. That was very insightful. Thank you. Now let's shift our focus to a common issue, the stigma surrounding schizophrenia. Could you please shed some light on the most common misconceptions about schizophrenia and how they're often perpetrated in the media portrayals?
Yeah, so people have a lot of misconceptions about schizophrenia. People often view schizophrenic people as violent or dangerous, but in reality, they're not violent at all. It's actually not common to have a symptom of violence when schizophrenic. If anything, if they abuse drugs or alcohol, then maybe they can get aggressive. But as a symptom of that disorder, no, it's not a symptom. And also another one people say is that people with schizophrenia have split personalities or multiple personalities. This is wrong because split personality is a personality disorder, not a psychotic disorder like schizophrenia. People with schizophrenia deal with hallucinations, disorganized thinking, and delusions, but not an alternate personality. Lastly, another misconception is that there is no treatment for schizophrenia, and if you are diagnosed with schizophrenia, you will not get better. That is also false because it's a chronic condition that can be treated with therapy, medicine, early interventions, support from others, and proper treatment. and that can improve that disorder, which is pretty good. And I want to step back to the first misconception of schizophrenia. I think that people like often think that they're violent because of like movies, like how
Yeah,
movies and
like how they
TVs
in the
portray
movies.
them. Yeah, like they usually like portray them as like these crazy people who like will go out and kill people, like
And
and all
just do
that.
insane
Yeah, but in
things.
reality, they is not like that at all. Like I don't know, it's just
Yeah, I can see that. It's like most killers, quote unquote, in the media have schizophrenia, but not every schizophrenic person
Right.
is a killer.
yeah,
Mhm.
basically.
Let's turn to the personal side of this. Tati, as a mental health professional, could you share a personal anecdote about a person with schizophrenia and the challenges they face?
I've actually had someone in my life who faced this condition. That someone was my uncle. Seeing it from a first-hand point of view was sort of heartbreaking. It was like he was trapped inside of his own mind and didn't know like everything was inside of his head. This made me feel sad because there was nothing I could do to like prevent it because I was just a little girl. I've observed that people, even my own family members, would treat him odd whenever he would have those episodes. His mental episodes would conclude of mainly hallucinations, but eventually he did pass away shortly after he was discharged from the mental health facility.
Thank you, Tasi, for your insight and your personal experience. So, schizophrenia is a complex mental disorder affecting an individual's thoughts, emotions, and behaviors. It manifests in various ways from hallucinations and delusions, social withdrawal, and cognitive impairments. While its exact cause remains unknown, a combination of genetic, environmental, and neurological factors likely contributes to its development.
The impact of schizophrenia on individuals and their families can be profound. It's essential to approach this disorder with empathy and understanding, promoting early intervention, effective treatment, and reducing stigma.
First of all, thank you everyone for attending this informative session. Your questions and insights have been invaluable. We hope this discussion has shed light on schizophrenia and encouraged understanding and compassion. If you or someone you know is struggling with mental health issues, please reach out to a mental health professional. Thank you and have a good evening.
Huge shout out to Dr. Brown for allowing us to conduct research in her lab for our project.
My name is Dr. Thunder, and thank you so much to my fellow mental health professionals, Dr. Goodwin, Dr. Bridgewater, Dr. Moody, and Dr. Page for taking the time to inform us about schizophrenia. If you found this episode helpful or thought provoking, please consider subscribing, sharing, or leaving a review. And if there's topics you're interested in hearing about, feel free to reach out to us and let us know. Remember, we're just psychologists, not manipulators. Come on now.
Once again, this has been the Abnormal Psyche. Understanding the mind one day at a time.
We're going to always stand on business because I'm standing on business. They standing on business. We standing on business.